Hi, today we want to talk with you about getting your children's eyes examined. So in our area and in many areas across the country, there are very large medical groups that are formed because of necessity due to managed care. And when you're in those groups, you sometimes see the pediatrician. The pediatrician says, well, you know, your child needs an eye exam and you should be seeing so-and-so. Now, is that the best recommendation? I'm sure the pediatrician cares about you, but as he's an employee of the group, he has to recommend someone within the group. And what happens then is you're usually referred to an ophthalmologist because those are the people that are in the medical groups. Is that a good thing? Well, if you have an infection, serious one that most of us can't handle, which is rare, yeah. If it's for routine care, no. And I want to talk to you about why. Because you do not want to go in the group to be seen by the ophthalmologist if your child is recommended by the pediatrician. You really want to go outside the group to an optometrist, especially one that does vision training, as we do, and some other doctors in the area do also. And Dr. Desai and I are going to talk to you about that so you'll understand why. So Jay, let me ask you a question.
Oh, please ask.
When a child comes to see you, what is it you do that's different that they won't get if they go to an ophthalmologist?
Good question. In addition to make sure they do see well for your distance, it's important to see how their eyes work as a team when they read. Because if their eyes overfocus when they read convergence excess, it can cause eye strain. If their eyes diverge when they read convergence insufficiency, that's another concern.
And what does that do? When a child has convergence insufficiency, how might that affect them in school?
Good question. They also find reading is a pain in the you-know-what. Because when they read, the words will appear to be jumbled together. It may split in half. They'll get headaches around here when they read. And they just cannot put the concentration to read.
Could they also just avoid reading and have no symptoms and say, well, I just don't like to read?
Sometimes, if it's moderate to severe, it does happen.
So you really can't tell just by what they do. If they don't read, they may not be interested in reading, they may not have symptoms, but they may still have a coordination problem. So when we test children, do we do anything special that really helps predict this or let us know if they have this problem?
Yes, we do. In the screening room, we do a keystone orthopter. It gives an idea what their eye muscle coordination is up close. We do a cover test in which when you have a child look at the target, we look at the eye muscle balance. And we also do testing, the one graph in which we make them see double vision up close. And we test to see when the two different images up close align.
So we basically do what we call child vision development, which is a graphical analysis, which means that we're able to graph a child's growth and change and see if they're going to develop a problem and if they have a problem. Now, if they do have a problem that we diagnose, do we do something that perhaps the ophthalmologist and the medical group don't do that would help with the problem?
That is correct. If a child has convergence excess, and when their eyes are focused to read, I do many times find out putting a child in a bifocal, they'll read much better, or reading glasses, depending on the situation. I actually had seen patients that they were diagnosed wrongly with being nearsighted because their eyes would overfocus so crazy. And when they focus up close, their lens changes shape. It makes them artificially nearsighted. But after relaxing their eyes with progressive no-line bifocals, I see them next year. They do much better and they don't get nearsighted.
So they don't need glasses for distance in that case if you catch it early.
That's right.
And what about graphical analysis and vision training?
Good question. If you do see a trend, for example, they have convergence insufficiency in which when they read and their eyes drift more and more apart and they don't have enough eye muscle strength to make their eyes converge together, then we talk about vision training, which the beauty is you can do it at home with the computer.
That's right. And that's something that ophthalmology doesn't do.
No, that's right, because they're really more into medical care, not the vision aspect.
So basically, in essence, we do more testing, we look for problems that ophthalmology does not, and we treat problems that they don't. And these problems are specifically things that affect how a child is developing in terms of their success in school and even the quality of vision that they may have and maintain for the future, perhaps being able to avoid wearing glasses. So what we're trying to share with you is that there are optometrists like us in this area that can provide vision training and testing for your children that will help diagnose problems early and prevent conditions. but you won't find that in the medical groups. And it's something you need to be aware of because the structure of America's medical care has changed. Doctors being forced into groups, and in those groups, they have to refer to other doctors in the group, so they look bad because they're employees, right?
That's right.
So if you as a consumer want to get the best of care, you have to be wise and say to yourself, well, if I need eye care for my children, I'm going to go outside the group and see doctors who can provide more because that's their specialty. The medical doctors in the group that are ophthalmologists are very important doctors because they do cataract surgery. They may treat all sorts of diseases that require surgery that we as optometrists don't. But when it comes to primary care, when it comes to getting your child the best care, preventative care, you're not going to get that from a surgeon, you get it from an optometrist.
That's right.
So we want you to keep that in mind and do be proactive. And when the pediatrician says, you need to see the guy in our group, you know he's got to say that because he's an employee just like the rest of them are. You don't have to follow his recommendation. You should be coming to see people like us who provide the preventative care that will help your children.
And finally, too, I was going to mention, if your child has been dismissed as being dyslexic, many times it's not. It's a simple eye muscle coordination issue.
That's a great point.
Yes.
That's right. People are often diagnosed as being dyslexic. They're told by the nurse in school or by a doctor, a pediatrician perhaps, if you have dyslexia, you need to start taking a drug to keep your child focused. Before you ever do that, absolutely be seen by an optometrist who does vision training, because if the problem is eye coordination, you don't have to put your kid on drugs.
That's right.